and I'm Dr. Revathi Miglani, endodontist, dental surgeon associated with Apollo Dental. And I'm very happy to educate you today on the root canal procedure or the root canal treatment, or otherwise known as the endodontic therapy. What is this root canal treatment? Before actually going to what is the endodontic therapy, you should all know about the anatomy of the tooth. So as you all know, the teeth are present inside the mouth, and usually we have two parts in it: the crown, the top portion, and the root, which is the bottom portion. And inside the tooth we have three layers, or there are three protective layers. So the top layer is the enamel. As you all see, it's a white layer, and then followed by dentin, and then you have the third, or the blood supply of the tooth, which we call it as the pulp. The pulp. This pulp is where it contains the nerve supply and blood supply of the tooth. So each tooth, like any other part of our body, is supplied with the nerve supply and the blood supply. So that is the reason why a tooth senses to hot, cold, sweet, or whatever it is, because of this sensation and the blood and nerve supply that it reaches. How it reaches the tooth? So through the root portion, the small channels or openings will be there through which these nerves enter the tooth. So these nerves and the blood supply is well protected by the dentin, and then top is the enamel layer. So when this enamel or dentin breaks, that might be because of your cavities, because of tooth getting fractured, or because of your wear. There's so many other factors. So then you start sensing pain, sensitivity, etc., etc. And then that is the reason where we go and do this root canal procedure. So why it's called endodontic therapy? Endodontics is a subject that deals with the root canal procedures. Endodontics means endo is inside the tooth, dontia is teeth. So when we treat inside the tooth, that is called as the root canal procedure, or more specifically, treating these root canals or cleaning up the dead nerve and the blood supply is the root canal procedure. So in cleaning these root canals, we open up or remove the cavity or the caries, then enter into the pulp, and we have specific instruments, we have specific agents, solutions to clean those channels, and then specific materials to fill it and seal it either from the top and the bottom. This is what is all about root canal procedure. And then once the root canal is done, it needs to be protected. So most of the times might be a good filling or a covering or a crown may be needed for the root canal done tooth. So root canal is basically nothing, the tooth loses its blood supply. So when it loses the blood supply, it's a dead tissue in our mouth. So I think, most of us know, having dead tissue is not good. So that's the reason where it's very important to treat those dead tissue, those root canals. So this is what is all on root canal procedures. Yes, of course, in the root canal procedures, usually the first step would be giving anesthetizing the tooth so that the patient, whoever is undergoing, is painlessly done. So once anesthesia, you open up the tooth, clean the channels properly, uses all the agents. Then we have a specific instruments like files, clean it up and fill it and close it. So this is the step-by-wise procedure on the root canals. And sometimes it needs one sitting, or sometimes two sittings or three sittings, and these sittings depends, even a day, or it might need an year, depending upon the infection that is present. So the earlier you get your teeth shown for the pain or sensitivity, the better will be the result of the root canal procedure. And root canal procedures are something, either you get a root canal done, or mostly it will go for extractions. So this is the last way to save or conserve the tooth. And sometimes the tooth are badly broken down that even a root canal cannot help there. So it's always important to diagnose whether, how good or the root canal procedure is going to be to assess the prognosis of the tooth. Always a diagnosis is the best thing, or the best plan to take the root canal. So a proper radiograph, or even sometimes a scan may be needed to assess the prognosis of the root canal procedure. So with these things, yes, we can take a step by step and predictably do a good endodontic therapy. And yes, who are all eligible? Yeah, most of the patients and healthy individuals are all good candidates for root canal procedures. But if they are associated with systemic diseases like any cardiac issues, renal issues, pulmonary diseases, or cancer patients, most of the situations it's always indicated, provided we get a fitness from their physician and discuss under hospital setups to get the root canal done under their guidance. So root canal is a safe procedure, a procedure to conserve your teeth, to save your teeth as a last resort. So with this introduction, I think I will end this and open it up to the question sessions. So you can post the questions so that I can help you and reply to you. So there's a question from Vaishnavi. Hi Vaishnavi, your question is, why should I see an endodontist for my root canal treatment? Can my dentist do it? Yeah, that's a nice question. Yes, of course, a dentist can do it. Dentist is also trained in the procedure, but a dentist with extra training on root canals, yes, definitely they are eligible to do a good root canal. And if sometimes, even we do 100 cases or 1,000 cases, the next cases is again a new. That's how the God has created the anatomy. So sometimes the case is better to be referred to a specialist who's been trained for 3 years. So the job is done, in a better way. There is no thing that the dentist, general dentist cannot do. He can do, provided that a proper training is being taken. And yes, if there's any difficulty, we can proceed or refer to a specialist. Then what is next question? Yes, hi doctor, why do I need a crown? So yes, why do you need a crown? See, the root canal done teeth, actually, to be more frank, these days, the technology has improved so much, the science has improved so much that the training of the endodontist also, if we do a very conservative access, conservative is, the less. But if you come with a tooth which has having a big cavity, like you lost 50% of your tooth, then it means that already the tooth is weakened. So it is weakened by another 50%, and our procedure, root canal procedure, further cleans, removes all the cavities. So the cavity or the crown portion becomes wider and the tooth becomes weak. It will be brittle. So after finishing the root canal, we are giving a good core of filling. Sometimes that is not enough to take your occlusal loop. Again, it starts breaking, and once it breaks, this time there is no point that you cannot restore it back to function. The point of doing root canal is bringing back to the function. That's more important. So if you're not going to protect your tooth with a proper restoration of filling, then there's no use of getting a root canal. So this protection has got different ways. It can be an onlay 3/4 the covering of your tooth, or it's a full crown. So definitely a protection is required after doing a root canal if the cavity is big. If there is no cavity, it's a healthy tooth. With the recent technologies, microscope enhanced root canals, definitely, some cases even they don't need. But most, yes, you need a crown to protect the teeth. So the next question is, what is the process of the treatment? So I didn't get you, Aditya, but what I understood is maybe the steps you're meaning in the treatment. So that's what I told you. It's usually root canal is done under anesthesia mostly. So after the anesthesia, we put a we use a sheet called rubber dam to isolate it. Then we open up, remove the dirt, access these canals, clean them up thoroughly. We usually use even the home bleach, that's what sodium hypochlorite, so concentrated. So aiming to attack and kill the bacteria. And then once the cleanup, you fill it with a material called as a Gatapaka. In most common terminology, I would say that it's a synthetic rubber. That's a universally accepted material. Once the root canal sealing is done, the top we give a good core using light pure materials, so that's a composite or amalgam, that's a fillings. So this is the process of the treatment. So doing, as earlier also I mentioned, that the visits depend upon the infection, the amount of grade you left it so late. It might be one visit, two visits, or multiple visits depending upon the tooth condition. So the next question is by Narendra. Yeah. Hi, doctor. Are there ways to help anxious patients? Can the root canal treatment be done under general anesthesia? Yes, of course, Narendra. Sedation is one thing to help reduce the anxiety. Even pre-anxiety drugs are being given to make calm the patient, and then you can do the procedure. Even under general anesthesia also treatment is done, but what the problem, I won't say it's a problem, but the issues what we face under general anesthesia is when the patient is taken to the theater. Theater is set up not for endodontics, taking all our equipment, but yes, of course it can be done. It can be done, yes. All becomes the cost, everything becomes as an extra factor. Yes, anxious patients can be handled with the anxiety drugs, and yes, educating them more. And yes, till now we have not discovered or invented any medicine for fear. If that was done, I think most of us will be very relaxed. And yes, different individuals have different experiences with root canal. Some have very painless, some have a bit of here and there. So that's the apprehension of the patient. Yes, definitely anxiety can be addressed and controlled and can be done. And what are the alternatives to, Sakshi is asking me, what are the alternatives to endodontic treatment? The only alternative to endodontic treatment is extraction. Just pull out the teeth. We don't want infection there. Yes. So either get a root canal done if we can save and protect the tooth. Otherwise, just get rid of your mouth. We can live without teeth. So just remove the teeth. And then, yeah, we have implants coming and taking the whole stage. So yes, you can get it replaced. Okay, so Kushbu is asking me, doctor, what type of food can one eat after and before the procedure? Yes, before the procedure, yes, whatever you want, you can eat and come to the doctor. After the procedure, yes, yes, let's have it soft diet, a semi-soft diet, maybe for a day or two, because the teeth is being treated, and surrounding the teeth, it might be a sort of disturbance. So just to make it more soothing for the tooth, yes, you can have a semi-solid food just for a day. Then after that, you can get back to normal. But even root canal done, avoid hard, like bone or the chips consistency till you protect your tooth properly. Whether it can be onlay, inlays, crowns, like that. So that completes that one. And then procedure time, please, Karthik. Karthik, the procedure time, it's easy to say, various endodontists do at various time levels. But, a simple tooth, minimum, I would say 45 minutes to an hour, depending upon the patient, the anatomy of the tooth. I'm telling you, unless we go see inside, we cannot judge the time. We plan. Let me say I took the scan, I take the X-ray, and I with all this, I'm planned to attack on the tooth, on the root canals. The moment I open, there's so many issues. So you should give a time to doctors so that they do the job, in a very satisfying way, so that we get a good predictable result, rather than hurrying up and just telling it's going to be done in 10-15 minutes. No. So it depends on the tooth and the situation there. So you must be prepared and give time to get the job done. How soon do I need to get the permanent restoration? So that's a good question. Pushpa is following me very closely. She's asking me, I was telling about restoration, how long, how soon? Again, this depends on the tooth, Kushbu, and the dentist that you've been seeing. If he dictates or tells you that please get it done immediately, get it done. Or he says you can wait for another 2-3 months. Yes, you can wait for 2-3 months and then get the crown. So then again, depends upon how the tooth is broken down. It's a small or large, and where it is. It's a front tooth, it's a back tooth, or it is in premolar, molar. So based upon the functional load and based upon its location, based upon the damage on the tooth, we can take a call and having a permanent restoration there. Is the root canal treatment, Sneha is asking me, painful? Painful, the tooth is already with pain, so that's the time when it needs a root canal. So but we have been trained as a dentist or as an endodontist or any other specialty is being trained to relieve the pain and do a procedure painlessly. We have so much techniques with anesthesia, even though the only one anesthesia agent we are using. So it will be made comfortable and a painless procedure. Yes, but sometimes what happens when the patient comes in a late stage, when they have severe pain and we want to relieve the pain and we tend to give the anesthesia sometimes does not work. That's because the tooth is in an infectious stage and you have procrastinated or delayed getting the treatment done to the tooth. And the moment everywhere the anesthesia works but not inside the tooth. That's called as a hyperemic blood supply or hyperemic pulp. In those stages, we face difficulty. So, but we want the patient to be more comfortable. So, we have some medicines to keep over the tooth, make it or kill or make it numb, and then continue the procedure. So yes, as an endodontist here, I would say that root canal is a painless, it's not a painful procedure. Then does the root come out completely and does it bleed heavily? What does this mean? Does the root come out? It's not the root, you mean the root canals. That is the nerve and blood supply is supposed to be, yes, the procedure involves removing the whole blood and nerve supply. So when we do that, sometimes it bleeds heavily. But once we remove and thoroughly clean it, yes, that's what I'm telling. When there is infection, the blood supply is more to the tooth. So the moment you remove this, when it is with blood, the moment you remove it, it starts bleeding. What you here have to understand is when the pulp or the blood supply of the tooth dies, it might be partially vital. It might have a little life in it or no life in it. When we say no life, it is a dead tissue. There's little life. So when we are trying to remove that little life and the bad broken down tissue there, it starts bleeding heavily. But it stops once the canals are cleaned. What happens after my root canal is done? Nothing happens. The root canal is just that it is clean. It is the root canal as treatment has helped you in devoid of all the infection. And yes, it is not temperature. It has no more life. The tooth in your mouth does not have life. It does not sense to hot, cold. But what it does is it's in its place and helps us in your function, in your eating, biting, and protecting your neighboring teeth, being in position, helping the opposing teeth, all this. So this is what after root canal, your tooth loses its blood supply. So there is no life, but it's in healthy and functional. Why is root canal necessary? That's what I mean. I in the introduction itself, I told you root canal is needed when the tooth blood supply is being destroyed or the caries, the fracture of the teeth, or because of other reasons, attrition or the wear of your tooth, it reaches the blood supply, the pain, then root canal is needed for your teeth. And sometimes when you need to replace your teeth, intentionally, the dentist advise you to undergo root canal because they call it as a plain correction where they need to give you a good aligned teeth. Then sometimes they might advise you root canal for those kind of teeth too. Can every tooth be saved with the root canal treatment? Yes, that's a good question. Usually, where when you have some tooth structure, that is, if it's a badly broken down teeth where you cannot fit a crown, where you cannot give a filling, permanent filling, then there is no point in getting a root canal done. And I don't think that this is and when there is a very chronic infection that cannot be settled with a procedure, where sometimes the patient leaves the tooth so bad that the infection will be silently killing away the bone and it spreads so much, and that stage you come, yes, if it will help, but some cases won't settle with root canal. Then that time those are bad cases for root canals. Yes, you have to go for extractions, and even if it is very badly broken teeth also, we are better to get them removed than to have a restorative challenge, because giving the to filling becomes difficult, not the root canal. Then I think again the same question, what happens after the root canal treatment is done? Yes, after root canal the teeth loses its life, it becomes non-vital. I mean, there's no life for it, but yes, it will be in its place doing and performing its function. Can root canal treatment be undertaken on the same tooth twice? Yes, twice, thrice, how many times, unless we have the tooth structure to do it. So it's always better the first time done properly. But sometimes what happens, as I said, the anatomy is so very different for each tooth when we open. There might be missed canals, or sometimes the infection does not settle. So, after some time again, the patient has a problem, and the next dentist says that, yes, we need to redo your root canal. Yes, it can be done provided you know what's the cause of why we knew. We call it as a retreatment. Re-root canal is not the terminology. Yes, it's called retreatment, and yes, it can be done. The way technology is moving and things have been happening in dental science, yes, you have good things to be done, so that what missed out in the first time can be corrected. So yes, definitely a root canal, sometimes if it is indicated, it can be done another time too, if it's necessary. So I think I answered most of your questions. I have one more there. Yeah, is if there is no pain, then still I will need the root canal treatment. Yeah, that is what I was trying to tell you. Pain is something for it's called a threshold. Each one of us will have a certain kind of a pain threshold. The pain I can take, maybe you cannot take. So for such patients, they will come immediately. But for some have got good pain threshold, they can take up. Their body is so good, they can take up much pain, so they'll be just delaying the treatment, and suddenly you visit a dentist for a checkup and he says this cavity is so big, so you need root canal. Yes, root canal, if the cavity is big and it is approaching or has reached your blood supply, and definitely even if there is no pain, you if root canal is indicated, yes, it has to be done. There is the root canal, it does not mean that only if there is pain I can get a root canal done. Nothing like, sometimes your pain threshold is good, your health is good, so you're not feeling that pain. But if your cavity is too big, where it cannot be, first two layers are only for fillings, beyond that it goes, then yes, we need to do that, the endodontic therapy, and then only give you restoration or the filling on the tooth. So yes, no pain, still if it is needed, we need to do the procedure. Yeah, yeah, I'm just what if I have pain if, even after the procedure? See, usually, Sneham, we usually tell the patient, even after root canal procedure, sometimes the pain may be there for a day or two, but not the pain what you had. Usually root canal pain will be disturbing you in the night. It won't allow you to sleep in the night. It will be hyper. The whole side will be paining and all that stuff. But after the root canal, you won't have that kind of pain. But since there is anesthesia prick and there's some amount of work done, you might have a pain, mild disturbance for a day or two. But after that, a properly done root canal will not have should cause you any pain. Then even after 3 or 4 days you have pain, then it means there is an issue, or you should attend. Or sometimes, the filling might be little high, that might be need to be adjusted, and all this stuff. So usually a well done root canal should not cause you any pain, and it might be there, after the procedure you can accept, you can have a pain, a mild discomfort for a day or two because of the procedure done, but otherwise there should not be any pain or trouble that was there for you all year. So I think with this we'll wind up, friends. I think my talk and answering questions has helped you. Hope we're always available anytime. You can ask us, approach us, and clear your doubts before coming to us. And we would love to see you and provide service for all of you. So here Revathi signing off, and see you all. Thank you.